Okay, the first time I'm going to actually use some cheat notes here. What I was doing is I just realized I was saying the same thing over and over again in a lot of patients, and these little aphorisms or little sayings that I tend to say over and over again. I thought it would be great to put this into one video. So what are the things I say over and over again? One is, let the punishment fit the crime. What does that mean? What it means is that if someone comes in for a little tiny thing and they want a big thing out of it, one, it actually may create a problem, and it's not going to help them. And I don't want to, for example, let's say they have a tiny mole and they want this removed and I have to do an excision to remove it. I may create a scar that looks worse because I'm doing this big procedure for a small problem. I've actually done a lady that had a wart that was on the entire part of her central front nose with hair growing out of it, and I actually did what's called a bilobe flap, like a cancer flap, because you can't close this primarily. Slid the whole tissue from above the nose all the way down into this area. She was only in her 20s. Why would I do something so ridiculous? Well, the reason is that I thought this big warted thing looked bad for her, and a skin graft would have looked bad. So I actually did a much larger procedure for her. So I always say, let the punishment fit the crime. And I always adjust what I would do for a patient based on severity of the problem. So a lot of times people take risks on things that they don't need to take risks on and do things that are inappropriate. And so that actually brings me back to my other aphorism, which is safety before quality. And there was a video I just shot a couple days on that, and you can probably find that on YouTube just by typing safety before quality and facial plastic surgery. The next aphorism I have is, I don't treat movement. And what does that mean? A lot of people come to me and say, don't you see this hole when I do this? And it's right there. And I say, yeah, and I'll fill the hole, and when you stop smiling, you'll have a bump. So when people try to do this, and don't you see when I do this, well, we all have different weird movements, that occur with muscle. So you can't fill in holes with movement. You've got to treat a static issue, not a dynamic one. Now, the only caveat, obviously, is muscle pull. With Botox, you can relax muscles. But in general, filling holes that are only apparent during movement is a bad idea. What else do I have here? The other thing is that symmetry. I say in my consent forms, the two sides of the body are not the same and can never be made the same. I've actually memorized that line from my consent form because people are so overly focused on symmetry. Everything I do is symmetrical, but the key is for you not to be overly whelmingly thoughtful about, oh, everything's got to be symmetrical. No one ever is symmetrical, and half the time people ask me about symmetry, I can't even see their asymmetry. And there's a great video about balance versus symmetry that goes more in depth in this concept. So I encourage you to try to look at that video, and you can probably type balance versus symmetry and lamb and see what comes up with that. A great one. I don't treat feel, I treat look. And that's important because people, for example, purlane in particular can be pretty firm for the first couple of weeks. They say, I got this lump, and they don't see it, they feel it, which softens over time. But I always want to be careful because if I smooth and push it really down, it becomes flat and it feels good and then it's gone, that's a problem. So I allow people for that 2 to 3 weeks to feel that. But even anything else, if let's say like I did a facelift and they feel really hard, they feel like a little scar tissue underneath or whatever it may be, I said, no one's seeing that. You cannot treat feel, you treat look. So that's another saying you may hear from me. I say these every single day. Two-finger rule, a concept that I talked about in one of my blogs, which is everyone says, can't you do this? When I stretch this, it just looks better. And I say no, because facelifts are muscle pulls. They're not skin pulls, and you can't stretch a wrinkle gone. The movement with two fingers and pulling do not equate with reality, so it's far, far, far from reality. I love this one. The only thing I can predict about human nature is that it's unpredictable. In other words, people ask me, do you think Joe Bob at work is going to, as a southern name, you probably not hear that on the East Coast, don't you think Joe Bob is going to see that I had a surgery done? Or do you think that I would be happy with this result? Do you think that you get enough hair to fill this area? And obviously I say, look at my before and afters. I have a lot of experience in what I do, but the one thing I want to be very careful with is telling you, oh sure, yeah, your wife will be totally happy with my work. Or you know what, I'm going to make you look 20 years younger. Or you're going to be so ecstatic with everything I do for you. Because I don't know what's in your head. Like here's another example is I had a lady that I was working with acne scars, and she said, Dr. Lamb, I thought you were going to give me 50% improvement. Well, she's so good, she's on my website, but the point is, what is 50% improvement? Can you document 50%? What is 55% improvement? It doesn't mean anything. So these percent improvements are also very dangerous things because I don't know what's in your mind. Or if I say your recovery is 7 to 14 days, what does that mean? swelling, bruising. At day 15, if you have even an ounce of swelling, have I lied to you? Where is that range? So I always want to be careful, and I use these aphorisms or these maxims or these sayings, just to make sure I've said everything I wanted to say. I think that's it. So that you remember that this is an imperfect science. I'm dealing with a lot with psychology, and in order to not be evasive but to be honest with you and set up parameters and guidelines for my work, I want to use these rules that hopefully will stick in your brain next time you go to the mirror and go, I don't know if Dr. Lamb could fix this, and I go, oh yeah, it isn't treat movement. Or, you know, I wish he could make these two symmetrical. Oh yeah, it's balance versus symmetry, and the two sides are not the same and can never be made the same. So a little short video summarizing all my aphorisms. Obviously, if I have more coming up in my mind, I'll give them to you in another video.